Hi, so my name is Nick Randall, and the topic I'm doing is ankle sprains in amateur male soccer players. So, an introduction, a common ankle sprain is a roll, twist, or turn of the ankle in an awkward way, and the ankle ligaments are forced beyond their normal range of motion. Um, and this injury routinely ranks among the most common sports injuries, and it can affect pretty much everybody through sports or other activities. So, not just sports, also through activities like walking, jogging, dancing, etc. For my research, um, I looked up how many injuries there were per year, just as a basic, getting a basic idea of how common the injury was. And there's about 1 million ankle injuries per year, and 85% of those are ankle sprains. From my research, I looked at an article called Ankle Sprain Injuries in Amateur Male Soccer Players. The study was conducted for 2 years. It included 312 male soccer players. And the study was conducted through surveys. So some of the questions through the surveys were the sprain injuries, time away from action, injury mechanisms, what part of the ankle was injured, etc. And the result, there was 208 injuries, and 139 of those were sprains. And this came out to about 7 sessions per injury missed. About 80.6% of the injuries were contact, while only 19.4% were non-contact. And in soccer, defenders are at a much higher risk than other positional players. Myself, I was a defender, and I sprained my right ankle 4 times. So I can definitely attest to defenders being at a much higher risk for it. So for my research, more research, short-term problems include pain with pressure, so touching, putting weight on it, any sort of pressure can stimulate pain. Tenderness, swelling, bruising, a restricted range of motion, so trying to move the ankle around, instability, and also a popping sensation when you're trying to move the ankle around as well. That's something I experienced too. I have a YouTube clip that discusses um, the long-term problems that could occur from ankle sprains. Some of those are instability, restricted range of motion, pain, other sorts of tenderness and swelling as well. And this is mostly chronic if you don't take care of it well and don't rehab it correctly. From a personal perspective, I believe sprains are common, or I know sprains are common and are well documented already. So there's not much left to explore in this type of topic. All answers have been covered by research. It's a very well-known injury. Like I said before, it's well-known. It's not. There's very, very little, if anything, that we don't know about this injury. And once injuries occur, trainers in various websites offer great ways to rebuild strength and range of motion. So some of the things I used were massgeneral.org or the Mayo Clinic. That sort of stuff really helped me, as well as the trainers, Kelly and Mariah at the Curry athletic trainers. And the conclusion, sprains are very obviously common, are extremely common in soccer, as well as other sports and other activities as well. It's hard to prevent, however, building strength and helping, what will help is stretching. This will help reduce your chances of having an ankle sprain or ankle injury due to, your ankle being more strengthened than a normal person's would. And time and rest are very key to reducing future chance of re-injury and long-term problems. If you don't take the proper time, the proper rest, if you don't use the methods that are given to you, the exercises, you're never going to get fully, recovered. And this can lead to, you having lots of potential problems in the future. That's something I experienced. I didn't take the proper time I needed to at first, and then it just lingered on, and now Although I'm not playing anymore, I know that the rest and the time away really you need to give your ankle a lot of time and rest to be able to avoid these types of injuries in the future. Thanks.